Almost everyone with diabetes eventually develops signs of retinal damage. The National Eye Institute estimates 40 to 45% of all diabetics are affected by diabetic retinopathy, and 24,000 of them go blind each year. When we visited Dr. Kent Small at the Macula and Retina Institute, we asked him to explain how diabetes affects the retina.
Really what we're talking about is how diabetes affects the blood vessels throughout the entire body. Because basically chronically elevated blood sugars, which is what diabetes is, damages the lining of the blood vessels throughout the entire body. The retina is one of the few places in the body where we can look directly in there and see that damage going on. And so just a little bit of damage, the retina is so fragile, it's such a fragile tissue, just a little bit of damage to the blood vessels can wreak havoc. The blood sugar damages the blood vessels in a couple of different ways in the retina and throughout the entire body. And actually, by the time we're starting to see damage in the retina, your internist can pick up damage in your kidneys, in your feet, in your nerves, and elsewhere in the body. So what we see in the retina is kind of a barometer of what we see going on elsewhere with the blood vessels throughout the entire body. But the damage that occurs initially usually is just some mild damage to the lining of the blood vessels, which then the blood vessels don't hold the blood and the serum in, and it kind of leaks out into the tissue and causes the tissue to swell. And that would be diabetic macular edema. Edema means swelling. And that is one manifestation of diabetic retinopathy, or how diabetes damages the retina. Sometimes, and particularly with younger age onset diabetics, the blood sugar damages the blood vessels so badly that the blood vessels just close off entirely. When that happens, the retina tries to heal itself by growing new blood vessels, which sounds like a good thing, except these new blood vessels are very fragile and they break and they bleed. And when they bleed, it can be a very catastrophic bleed, very sudden cataclysmic bleed. The type 1 diabetics, the younger age onset diabetics, tend to get the full closure of the blood vessels and the blood vessel growth, which is we call proliferative diabetic retinopathy, proliferative meaning growing. The type 2 diabetics, the later age onset diabetics, tend to get more of just the milder damage to the blood vessels where the swelling occurs in the macula, in the retina. The big issue is, there's 18 million Americans with diabetes. That incidence has tripled in the last 30 years because of our incidence of obesity that's been increasing. More importantly, about 5 million of those people don't even know they have diabetes. The risk of diabetic retinopathy and the risk of vision loss from diabetic retinopathy can be decreased by 95% if picked up early and managed and treated properly.
Is there any way to prevent diabetic retinopathy?
Managing and controlling blood sugar, blood pressure, weight, and cholesterol improves your odds and basically decreases the incidence and progression of diabetic retinopathy. So good systemic care of the diabetes is of course important. Once diabetic retinopathy has developed, the standard treatment is still laser photocoagulation, basically taking a laser and trying to seal the blood vessels from leaking and bleeding. More recently, there's been studies showing that injecting medications into the eye, such as steroids or anti-VEGFs, anti-vascular endothelial growth factor medications, also help to control diabetic retinopathy and improve vision in some cases. Every diabetic, whether they're type 1, type 2, should have a full, dilated, comprehensive eye exam every year. The findings of diabetic retinopathy, when they're picked up early, are very easy to treat and manage and to be able to maintain good vision. The people that get into trouble, the people that go blind from diabetic retinopathy, are people who don't get in and get their eye exams and don't take care of themselves and aren't compliant with their medications and don't follow their internist's orders.
And what are the treatments for diabetic retinopathy?
First is laser photocoagulation treatment, where you seal the blood vessels. Sometimes in combination with injecting steroids or anti-VEGFs in the eye. And if those don't succeed, the next step up usually is a vitrectomy, surgery, going into the back of the eye, removing the vitreous jelly. And a lot of times, particularly when these new blood vessels have grown and have broken and bled, it causes a lot of scar tissue that can pull the retina off and detach the retina. So going in with surgery and removing that blood, removing that scar tissue is often beneficial. That's a vitrectomy surgery.
For more information on Dr. Kent Small and the Macula and Retina Institute, please call their Glendale office at 818-552-5040 or their office in Los Angeles at 310-659-2200. Or you can visit their website, maculaandretinainstitute.com.